Hi everyone. So today, we're going to be going over public health, along with some current events in medicine. Public health is a very important aspect of medicine. In some of my college classes, we've learned that only 10% of a person's health is attributable to medical care. So a lot of the public health factors, including the environment that they live in, their access to transportation, resources, that also impacts their health and in a much more significant way than just their medical care. And so Bian's gonna be talking about this today, and then uh, kind of applying this to how we promote the health of all people, regardless of where they live or their socioeconomic status. And then some trigger warnings. We do talk about some mental health issues, self-harm, and substance abuse. But I'll be heading off to Via.
Okay, thank you, Viva, for that amazing introduction. Let's go straight into what is public health. So, like Viva mentioned, it's protecting and improving the health of all people and communities, regardless of their socioeconomic status, their race, gender, promoting healthy lifestyles, and that includes researching disease and injury prevention, detecting, preventing, and responding to infectious diseases, which is very important in these modern times, um, and advocating for healthcare equity, quality, and accessibility. So let's move into the history of public health. There are those two pictures. You see Dr. John Snow on the left and Sir Edwin Chadwick on the right. So these two are known as the fathers of public health, and we'll get into why as we move on. So the history of public health displays the importance of improving general social conditions. So that includes housing, food supply and quality, and sanitation. So the improvements on the health of many populations over centuries result from the improvement of these conditions. And like Viva mentioned, it's not always attributed to the medical systems that are oriented towards like the care of individual people, caring for individual diseases. And modern public health is shaped by two factors. So the first one is that more scientific knowledge has been found about the sources of diseases and means of controlling them. And there's also been increased public acceptance that disease control is a public responsibility, and that, of course, like epidemics, pandemics can occur at any time, and our response methods need to be um, good to handle that. And throughout history, epidemics, so like the plague, cholera, and smallpox, they've resulted in very sporadic efforts to control those diseases. So they haven't been very organized. But by the 18th century, isolation and quarantine, they became very common measures of containing disease. And of course, there's also been great advances in public health since the 19th century. So illness at that point became attributed to poor social and environmental conditions. That led to more of a focus on sanitation, as well as this acceptance that protecting health is a social responsibility. So let's move into Dr. John Snow. He was an English physician. He was known for his work in advancing the field of epidemiology, and he conducted investigations on cholera epidemics in England. This was in 1854, and his research was particularly famous in London, where he demonstrated that despite public belief, cholera is a waterborne disease. So back then, before a lot was known about cholera, many people thought that this was an airborne disease, that cholera can be transmitted the same way that like COVID can. Um, and John Snow's research, he used that map on the right, and that shows all of these outbreaks of cholera, and he was able to connect them all to a single water pump on Broad Street. And this associated cholera cases with a contaminated water pump. And as a result of that, there were these efforts that were made to improve the water and the waste system in London. Following that, Snow also did a study called the Grand Experiment, where he compared waterborne cases in two regions of London. So one of these regions received sewage contaminated water, and the other received like relatively clean water. And due to this, John Snow showed why it's super important to have clean water and healthy conditions. And this suggested like remedies and intervention strategies to ensure that all people, regardless of where they live, have healthy conditions to live in. And of course, his models are still used by epidemiologists all around the world. His reasoning and his approach are still considered very valid and very exemplary. And John Snow, of course, we mentioned two of the main factors of public health. He provided for one of those two, so increasing knowledge about the sources of diseases and the methods of control. And now we'll move on to Edwin Chadwick. So he was also known as the other father of public health. He was an English social reformer and advocate for public health, and he shaped 19th century public health policies. He was originally a lawyer, but he devoted his life to sanitary reform in Britain. He was also alive at the same time as Jon Snow, so same thing, cholera outbreak, and there was a bigger focus on health as a public responsibility. He was the secretary of the Royal Commission, so he reformed a lot of poor laws, and he devised British systems where groups of parishes, so like these regions, are administered by elected boards, and each of those elected boards needs to have its own medical officer that could implement health policies, health regulations. Later on in his life, he was the commissioner of the Board of Health, so he campaigned for the passage of the Public Health Act of 1848. And this act did summarize Chadwick's belief that public health is something that should be administered locally to all communities, not just like administered at a national level, but also at local levels so that we're able to respond quickly to whatever different communities need. It also established the foundations of modern public health with goals to improve sanitation, so kind of in response to John Snow's research on cholera outbreaks. And he created the General Board of Health and the local boards of health. So, again, his belief that public health should be administered locally. And this is the first time that the state ever guaranteed standards of health and environmental quality to its citizens. And of course, he provided for the other factor of modern public health. So, increased public acceptance that disease control is a public responsibility, and that, of course, government needs to have a role in. So, public health, there are 10 essential services that many people believe public health needs to provide. So, the first one is assessing and monitoring population health status, factors that might influence the health of those communities, and of course, knowing the community's needs and assets. So, public health does use a lot of statistics and data, and that data information is used to determine the causes of health disparities and inequities. And that data is also used to kind of identify any emerging issues and how people need to respond to those issues. This also includes working and engaging with communities to understand their health needs. Of course, different communities will have different health needs. The second one is to investigate, diagnose, and address health problems and hazards affecting the population. So, kind of building off of number one, this is anticipating and preventing and responding to acute outbreaks, emergencies, and health hazards. The third one is communicating effectively to inform and educate people about health, factors that influence health, and how to improve their health. So, making sure that everyone has accessible health information and resources. That way, they can take a bigger role in shaping their own health journey, of course, knowing their own needs um, and knowing what treatments they need. Number four is to strengthen, support, and mobilize communities and partnerships to improve their health. So, engaging with communities and developing public health solutions that are applicable to many different communities. And number five is to create and implement policies, plans, and laws that impact health. So, of course, public health is very closely tied with government. They'll need to develop and enforce policies that ensure fair opportunity for everyone to achieve optimal health. Then 6 to 10. So 6 is to utilize legal and regulatory actions designed to improve and protect the health of the public. So that includes like licensing and credentialing the healthcare workforce, and of course, licensing and monitoring the quality of healthcare services to make sure that everyone's getting high quality service to respond to their health needs. And also to ensure that laws are applied to protect the public's health. So, of course, we can create laws, but they must be enforced in order to have an impact. We need to ensure an effective system that enables equitable access to the individual services and care needed to be healthy. So that includes like addressing and removing barriers to healthcare, and building relationships with like healthcare providers in order to make sure that everyone is getting healthcare, like regardless of who they are. Number eight, of course, building and supporting a diverse and skilled public health workforce. So ensure that the public health workforce is like large enough and appropriate size to meet the public's need. And of course, build a culturally competent public health workforce to respond to different cultures, and like any medical needs they might have. Number nine, to improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvement. So same thing, how it's very linked to research and statistics. Public health officials do need research and evidence and data to inform the decision making and make sure that any regulations they're creating are appropriate for the community they're serving. And finally, the last one is to build and maintain a strong organizational infrastructure for public health. So, of course, officials, doctors, they need to be accountable with all partners and communities, and also to ensure that resources are administered equitably. So now we'll be diving into 8 current public health challenges, so how public health does apply to current day problems. So the first is healthcare systems. Over the past few centuries, there have been vulnerabilities in health systems, regardless of income, and half of the global population right now lacks access to essential healthcare services. Mental health crises, mental health concerns have increased to have like a higher incidence than cancer, and that's led to a push to fund mental health support programs. Malnutrition and food safety. This affects 29% of the world's population, and globalization of food production has increased the extent and speed of foodborne pathogen transmission. So it's a much bigger problem than it was a few centuries ago, a few decades ago. Infectious diseases. So the emergence of new diseases calls for the improvement of healthcare equity and quality, and also financial assistance to public health. We have environmental pollution. So this is a problem that threatens humans, wildlife, and habitats, and can also trigger security and political threats. As environmental pollution increases, a lot of communities are disproportionately affected. They may have to move out of that area. That leads to a lot of political and security problems relating to that. Climate change also plays a factor, of course, as climate change is worsening. There's a lot of effects that are happening to different communities around the world. Cancer is globally a leading cause of death, and lack of access in healthcare contributes to a mortality rate in many countries. There's substance abuse, so this includes excessive use of alcohol, pain medication, or illegal drugs. And the only current strategies to responding to substance abuse are punishment and criminalization. And one public health challenge is working on how we can respond to that in a way that's more tailored to fit to serve our communities and help them recover rather than punish them or criminalize them. And finally, you have cardiovascular disease. So that is the leading cause of death in the United States for the past century. And what is a problem about cardiovascular diseases is that the impact, the mortality rate can be reduced through proper treatment and management. And first we'll dive into each of these topics in detail. So let's talk about healthcare systems. The World Health Organization defines a good healthcare system as one that is safe and effective. So it'll take in each individual's unique needs, preferences, and values of how they want to receive their care. It's timely, so wait times are minimized to avoid harmful delays. It's equitable, so there's always access to essential care. It's integrated, so there's a full range of healthcare services that are available throughout a person's life. And it's efficient. So in these healthcare systems, the benefits should be maximized and the waste should be minimized. There are four models of existing healthcare systems. So there's the beverage system in the UK. That's where healthcare is paid through taxation. These health facilities are government owned, and providers are employed by the government. There's the Bismarck system, which you see most commonly in Germany. So the healthcare system is privately funded. There are mandatory like payroll deductions, or they're called sickness funds, and care facilities are always reimbursed. There's the national health insurance that you see in Canada. So healthcare is paid through taxation, much like Britain. But the delivery of healthcare services are privately owned. And then there is uninsured. So those who can pay receive healthcare, and those who cannot do not receive healthcare. So the US combines it uses a combination of all four method models that we just used, and that results in 28 million Americans being left uninsured. So there are major issues with using this combined system. So there are many, many preventable medical health errors. So this causes 250,000 deaths per year, and these preventable medical errors, they are the leading cause of death after heart disease and cancer. There are increasingly high costs of care. So cost of care today, and back in 2018 for a stat, it's 15% higher than it was in 2014, and it tends to keep increasing. So with those high costs of care, we do use an uninsured model. Those who can pay do receive it, and those who cannot pay do not. Um, Nursing and physician shortage. So demand keeps growing for nurses and physicians, but there aren't enough doctors and physicians to respond to these needs. There is uneven care. So the healthcare you receive does vary based on where you live, conditions, your insurance plan. One of the biggest models of this is urban versus rural care. Um, Urban places, you usually have a very speedy access to healthcare. In rural areas, not very much so. Lack of efficiency. So clinical documentation and electronic medical services limit a physician's ability to provide care. And off days. So many patients can only get service on the weekdays, not at night or on the weekends. And then our second current event that was mental health crises. So longstanding mental health crises have recently worsened. Many of it, lots of these cases have been attributed to isolation of the pandemic. Suicide is the second leading cause of death in people aged 15 to 24. So a few stats to go with that. 20% of high schoolers do report serious thoughts of suicide. 9% have made an attempt on their life. And mental health is linked with social media. So 32% of teenage girls on Instagram, they feel bad about their bodies. They respond to a lot of things they see on Instagram, and that affects how they see their body. 40% do report feeling unattractive, and 25% of all teenagers don't feel good enough. Um, and pressing issues that also affect our mental health. There's climate change, so we do question like the planet's habitability. So like if we're able to live here, and the actions of the government and political leadership that we agree with or don't agree with to respond to this crisis. There's also mass shootings. So there were over 200 mass shootings by June of 2023. That was like halfway through the year. And anxiety related to these attacks can have a huge impact on a person's mental health. So malnutrition and food safety, that was our third one. Unsafe food does create a cycle of disease and malnutrition, and that affects infants, young children, elderly, and sick individuals. Safe food supply does contribute to food security, and that supports national economics, trade and tourism to the country, and it also stimulates sustainable development in that country or area. Um, Unsafe food can carry bacteria, viruses, parasites, and chemical substances. That can cause more than 200 million diseases, from diarrhea to cancer. About 600 million people, so about 1 in 10, fall ill every year after eating contaminated food, and that does result in 420,000 deaths, and the loss of 33 million healthy life years. And some challenges in making sure that we are providing safe food, changes in production and supply, imported food rather than growing it in one area and then distributing it to people who do live locally in that area, changes in our environment, and new and emerging bacteria, toxins, and antimicrobial resistance. Our fourth one was infectious diseases. So this includes diseases that can be passed directly or indirectly from a person. So that includes flu, measles, COVID, or salmonella. Um, the increasing scope of infectious diseases and outbreaks calls for an improvement in our healthcare services, an improvement in public health responses that are critical for like creating effective measures to respond to these outbreaks. So after COVID-19, there was a very big impact on public health and officials like responses. So there was research conducted on 36 infectious diseases, and that followed like a decreasing trend before like increasing again after the conclusion of social distancing. So that research increased over time. Untreated STDs were an important cause of female infertility, and due to the lockdown order, of course, many did not have access to screening. And congenital syphilis in pregnant women. So the lack of screening prevented detection. And congenital syphilis does provide for a very large percentage of prenatal like mortality and complications. So this kind of highlights why even with like infectious diseases, we need to have a very speedy and appropriate response in order to make sure that these essential services are provided to the people who need them. Environmental pollution. So this can cause heart problems and health problems. So like respiratory diseases, heart diseases, and some types of cancer. About 12 million people per year die due to living or working in these unhealthy environments. And this does show kind of the disproportionate effect on communities. So people in low income areas are more likely to live in these polluted areas and drink unsafe water. Human activities, of course, do affect the environment by producing pollutants in the water, the air, and the soil. And long-term effects of air pollution, for example, include chronic asthma, pulmonary insufficiency, and perinatal disorders. So that includes infant mortality and chronic illnesses in adults. And of course, researching environmental pollution and creating policies to reduce different types of pollution can prevent serious health problems and death. So again, that links to why public health is so important in fields like government and why it's linked so closely to policies, because implementing and enforcing these policies can result in healthier communities. We have cancer. So this occurs when genetic changes interfere with cell growth, and that leads to uncontrollable growth of these cells. And public health scientists are currently working to develop interventions to reduce cancer risk. support research to reduce cancer disparities. Of course, because certain groups can suffer disproportionately than others, and ensure that cancer survivors do have the best quality of life, because many do suffer from lingering health problems caused by disease or treatments that they undergo to kill these cancer cells. About 8.9 million Americans are affected at some point in their lives by cancer, and that results in over $156 billion spent per year. And moving forward, research in cancer can allow us to raise awareness, um, increase the types of prevention that we have, and support patients. And raising awareness can also help donations and fundings that go to researching this issue. And then we have substance abuse. So this refers to the excessive use of a drug, this can be detrimental effects on yourself or society. So there's physical dependence, where the use of a drug results in an altered physiological state, and results in very severe withdrawal symptoms. There's psychological dependence, where you feel a need to continue taking a drug even when you're not physically dependent on it. And beginning in the 1900s, laws have been created in many countries um, in response to substance abuse, and that's resulted in an increasing governmental regulation and a role in controlling these substances. Drug use today does continue to be a legal and a medical problem that public health officials are still trying to respond to. Currently in the United States, you may know the enforcement of laws by federal agencies. So the most commonly known are the Drug Enforcement Administration, your DEA, and the Food and Drug Administration, or the FDA. And then finally, we do have cardiovascular disease. So there's four main categories of cardiovascular disease. There's coronary artery disease or coronary heart disease. So this is the blockage or narrowing of coronary arteries, mostly due to cholesterol like plaque buildup in your arteries. That is the most common type. There's cerebrovascular disease that affects blood flow to the brain. And a few sessions ago, we did cover strokes and transient ischemic attacks. Um, and then there's peripheral artery disease. So that's the blockage or narrowing of peripheral arteries to your limbs. So that can cause pain, trouble walking, or sores on your limbs. And then finally, there's aortic atherosclerosis. So your blockage or narrowing of the aorta. So that's your largest artery, and that stops blood flow to many organs. And that can be very dangerous for your body. And it is the leading cause of death worldwide, cardiovascular disease. Around 17.9 million people died of cardiovascular disease in 2019, and that was 32% of global deaths. So now we'll be moving on from current events in public health to what you can do in public health. So we have career pathways. Public health professionals, they analyze and consult public health policy. They can create and implement public health education proposals. They investigate the origin and the best treatment of different diseases. And they also conduct research and analyze demographics in order to help prevent disease outbreaks in certain communities. So public health degrees, you can see the careers on the left. You can pursue a career in public policy, epidemiology, biostatistics, public health administration, global health, maternal and child health, nutrition, or health education. Um, and here are some degrees in public health you can obtain. These do apply to California, but there are different degrees that you can obtain in different states. So you have your bachelor's. You can obtain both a bachelor's of arts or a bachelor's of science in public health. So for bachelor's of arts, you'll be focusing more on the cultural and economic aspects of public health. For bachelor's of sciences, you're focusing on natural sciences, mathematics, statistics, and chemistry. And you'll be learning about the 5 Ps of public health. So prevention, promotion, protection, population-based care, and preparedness. You can obtain a master's. So specializations include in health communication, health policy, program planning, and evaluation. So making sure that those programs are all efficient and doing what they're supposed to do, or in global health. So as you're getting your master's, you might be participating in internships, semester-long research projects, or grant proposals so that you're receiving funding for certain topics. And then you have your PhD, so population health sciences. This has a doctoral level research and training, and you're mostly understanding origins and determinants of health and disease. So different fields of study that are in this PhD, you can study biostatistics, you can study environmental health, epidemiology, health policy, or social and behavioral sciences. So the 5 Ps of public health, that's what you'll be learning if you do decide to obtain a bachelor's degree in public health. This highlights the need for public health policies, for collaborative partnerships, preventative measures, promotion of healthy behaviors, and how you respond to potential health crises. So prevention, that includes strategies to stop and reduce health problem occurrence. This might be, of course, educating the public, lobbying for legislation to be passed, immunizations or delivering vaccinations, and conducting research. There's promotion, so that aims to improve the health of individuals, the communities, or collectively as a nation. And that's enabling people to increase the control they have over their health and improve their health. So this might include communication, mass media campaigns, public service announcements. There's protection, so you're preventing the spread of diseases, establishing and enforcing those regulations that are created with legislation and like lobbying different governmental bodies. You have population based, so that's directing efforts at the entire population, changing community attitudes about a certain health problem, awareness, and their behaviors as how they respond to that. And there's also preparedness. So that's the ability of communities, of healthcare systems, and of individuals to respond quickly to emergencies and any arising public health crises. So we have the fields of study that you could be going into with a PhD, and we'll be going over each of those in depth. So for biostatistics, that uses statistics to answer new questions. So like how does a new drug work? What causes cancer and other diseases? And how long will a person with X disease live? What is their estimated like years to live? So that gathers and analyzes data on biological factors. So for example, infectious diseases and pathogens, like how do they impact our health? And this relates to how contagious the disease is, maybe how a population responds to a pharmaceutical drug, medical research or clinical trials, and or even the effectiveness of a public health campaign. How well is this engaging a community? And a biostatistics background is vital in epidemiology, nutritional and public health well-being programs, environmental health, health services research, and development of healthcare policy and management. We have environmental health. So this raises the big question of how does the environment affect people? Some examples of this, toxic chemicals that are found in consumer products, climate change and air pollution effects, and the consequences of oil spills and water contamination. So people who are choosing to focus in this field, they're designing experiments, they're gathering data, performing analyses, and researching different environmental factors that affect our well-being. So they're also preventing disease and disability. So that involves these fields, reproductive or developmental biology, um, epigenetics, genomics and structural biology, and all the way down to cellular and molecular pathology. So making sure that they're well versed in all of these fields in order to prevent disease and disability. This epidemiology. So this studies what causes these outbreaks to treat existing diseases and prevent any future outbreaks. So this might involve how diseases are transmitted, effective treatment of those diseases, why certain diseases occur in different groups, so why there are these disproportionate effects on different communities, and noting and analyzing patterns in disease occurrence and how populations are affected due to those occurrences. So the information gathered by epidemiologists is used to develop and improve both clinical and medical research, as well as preventative healthcare. And epidemiology is involved in health science, medicine and nursing, biostatistics and modeling, and health administration. And moving on, there's also health policy. So this is defined by the World Health Organization as actions, plans, or decisions taken to achieve a specific health goal. So this may be defining a vision for the future through a specific health policy, outlining your health priorities for a certain community, establishing targets or reference points for measuring progress towards those health goals. So making sure that these programs are doing what they're supposed to do, that they're keeping these communities on track to achieve a healthier lifestyle. Um, and educating and informing people while building like consensus on what certain health policies are effective, which ones are not effective. Current health policy today focuses on health promotion and disease prevention, patient safety and consumer protection, HIV and AIDS, healthcare policymaking, research, and government health insurance programs and healthcare access. And finally, we do have social and behavioral sciences. So this includes subjects such as sociology, psychology, and anthropology. Behavioral scientists do study the behaviors of groups and individuals. So this allows scientists to see the impact on personal development, relationships with other people, and predicting possible future behaviors. They most commonly work for government agencies, So maybe like for the federal government, for the local government. And this includes like performing research to understand potential health impacts for certain populations, and after performing that research, helping develop programs to overcome these predicted challenges. Modeling predictive behaviors, so working to develop therapies and methods to eliminate harmful behaviors that might occur in the future. Creating data sets to better understand and predict behaviors for policymakers, and developing and implementing therapeutic approaches to help people change their behaviors positively. And that does close out our public health presentation. So if there are any questions, you can feel free to leave them in the chat or email us. And that is our last session of this semester. So we hope to see you guys all back in the spring when we return.
Yeah, thank you for that presentation. That's wonderful. If anyone has any questions, you can feel free to put them in the chat. But as Vian talked about, public health is super important. A lot of the time people go to the hospital because they're experiencing pain or discomfort, which are symptoms of underlying disease. And at that point, the disease has gotten very severe or not manageable. But public health focuses on preventing these diseases in the general population, and then also kind of screening for these diseases earlier so that doctors can implement interventions at an early time period, which is more effective for treating the disease. And it's also important to increase access to um, care for various populations. There are homeless populations, incarcerated populations, refugee populations, immigrant populations, all who need care. Um, and in like if even if doctors are able to provide really high quality care, if people aren't able to access it, that's not effective for the entire population. Um, and even if you're interested in medicine, you can pursue a PhD in addition to your MD degree in public health sciences, or a lot of doctors actually have an MPH degree, and that allows them to look at clinical data from their patients and kind of sorry, yes, you can call there are many hotlines for help and assistance for people who are experiencing mental health crises. um I lost my train of thought, but yeah. So in the field of public health, you can actually pursue an undergraduate degree in public health. A lot of people do that on the pre-med track. And then you can also get a master's of public health, which takes like 1 year after you are done with your undergrad. You can do a 5 year master's degree, which we have at Brown. Um, or you can also get an MPH degree, a master's of public health after you get your MD degree. And if you want to do a PhD, that could take 4 years. Yeah, but a lot of doctors also help with these interventions. For example, in Rhode Island, we have excellent stroke care. So when a person has a stroke, it's very important for them to get timely care. Um, and so the doctors here are able to create a system where we can triage very well. And so the outcomes of stroke patients are actually improving in Rhode Island. And that is something that can be implemented in different states as well. And that's why public health is a super important application in the field of medicine. Um, and then kind of like one of the projects that a group at Brown is working on is helping orphanages, prisons, and different populations in a city in Ghana obtain screening resources, because a lot of times different countries don't have equal access to vaccination or screening, and that can affect their health and their health outcomes. So if anyone's interested in that, feel free to reach out to try to connect you with some global health projects or public health projects. Um, and yeah, that's definitely something to be aware of and to know about in addition to an MD degree, which a lot of people know about, but kind of playing a role in public health is also very important for the population. And if anyone has any questions on that, you feel free to reach out through email or speak to us after. Okay, I'm gonna check the chat one more time for questions. We did not have planned a Kahoot for today. Um, yeah, but like Vian said, we'll plan more next semester. Yeah, and the hotlines and I hope I answered the question about how long it takes to get into the field of public health. Because you can be engaged in that throughout your career. Um, so it's not like a detour or anything. You can still keep on track. Um, and then if you call the suicide line, a volunteer or a professional will be speaking to you to kind of gauge your mental health and try to help you out. Um, yeah, but that's all we have for you today. I know it's the last session, so if anyone has um any like personal questions or any unanswered questions, feel free to reach out. And then next semester, we'll be launching our schedule soon. So look out for an email for that. Um, and then yeah, have a good weekend, have a good rest of your semester. And if anyone has needs help with anything at any point, feel free to reach out through email.